Jonathan. Thank you, Jonathan.
Thank you, Toastmaster of the Day, fellow Toastmasters, and our honored guests. The title of my speech today is 3 important questions you should ask a doctor that you're meeting for the first time. 3 important questions to ask a doctor that you're meeting for the first time.
How much money you got in the bank?
The doctor-patient relationship is one of the most important relationships we have. Our lives, our very existence depends on making the best choices, along with our doctors, for our health and medical care. When I was thinking about what these questions should be, I thought about it from a patient's perspective. I thought about what I would want my doctor to know about me and what I would want to know about my doctor. Some of these questions may sound rude or offensive at first, but any good doctor should not be offended by these questions. I certainly wouldn't. Besides, people are saying offensive things to me all the time. I'm used to it. The answers to these questions will ensure that you and your doctor are on the same page to make the best decisions for your medical care and optimal health. The first question you should ask a doctor that you're meeting for the first time is, what's my name? Doctor, what's my name? Patient misidentification. Patient misidentification is a serious problem that has resulted in mistakes in diagnostic testing, incorrect medication administration, and wrong site surgery. They cut off the wrong leg. I hate when that happens. How can patient misidentification happen with the widespread availability of computerized medical records and sophisticated computer technology? 2 words: human error. You can tell I'm from New York because I say error instead of error. The 2 most common human errors that cause patient misidentification are mistakes made during patient registration. One number or one letter off throws everything off. And confusion between patients with similar names or birthdays. I had an episode of name confusion happen to me the other day. For this example, I'm not going to say the patient's real name. I was scheduled to see a patient who I was told name was Michael Joseph. The patient's actual name was Joseph Michael. When I walked into the exam room, I said, "Hello, Mr. Joseph." He returned my greeting and didn't correct me. I went on to interview and examine him based on the medical records of Michael Joseph instead of Joseph Michael. Fortunately, the mistake was discovered before he left the building, and he received the correct medication and medical tests. When meeting a doctor for the first time, be certain the doctor has your correct name and accurate medical records. The second most important question you should ask a doctor you're meeting for the first time is, did you wash your hands? Doctor, did you wash your hands? Hand-to-hand, hand-to-skin contact is one of the most common causes of disease transmission in the world today. Proper hand-washing technique can reduce the risk of germ transmission from person to person by more than 50%. Hospitals have instituted strict hand-washing protocols to prevent the germ transmission from doctors to patients. I found this out the hard way. I'm a little embarrassed to admit this, but I was caught red-handed being out of compliance with the hospital hand-washing protocol. Don't get me wrong, I'm not a dirty person. I always washed my hands when I came to the hospital before I saw my first patient. I always washed my hands after seeing a patient. But I didn't always wash my hands before seeing my next patient if I hadn't touched anyone or anyone in between. It seemed like they were still clean to me. That wasn't good enough for the hospital hand-washing protocol police, who were everywhere. Because I was caught being out of compliance with the hospital hand-washing protocol, I was summoned to the chief of medicine's office and sentenced to the hand-washing protocol punishment. The punishment was one of the worst forms of torture I've ever experienced in my life. For my punishment, I was forced to watch an online video course about proper hand-washing technique. The course was 2 hours long, and it featured a series of video clips of hospital personnel going in and out of patients' rooms washing their hands before and afterwards. Each clip was about 5 minutes, and there was a series of questions after each clip. There was no way to fast forward through the video, so I had to sit for 2 hours watching people wash their hands. Total torture. But guess what? After I finished the course, I've never forgotten to wash my hands before and after touching anyone. I would do anything not to have to watch that again. Don't be afraid to ask any doctor if they've washed their hands before they touch you. Finally, the third most important question you should ask a doctor you're meeting for the first time is, how many times have you done the procedure or given the medication that you're recommending to me? Doctor, what is your experience with the treatments you're recommending? A wise man was once asked, Mr. Wise Man, what is the secret for success? The wise man answered, the secret for success is the ability to make good decisions. He was a wise man with a deep voice. The wise man was then asked, but how do you get the ability to make good decisions? The wise man answered, one word, experience. The wise man was then asked, but how do you get the experience to have the ability to make good decisions? The wise man finally answered, you get the experience to have the ability to make good decisions by making bad decisions. The practice of medicine is a science, but also an art. In medical school, we learn the science of medicine by studying medical books and by taking many exams to be certified as a doctor. The art of medicine, however, can't be found in books. We learn the art of medicine by taking care of patients under the supervision of more experienced doctors. In other words, we learn the art of medicine by practicing on our first patients. We practice until we get it right. Now, my friend Dave here is a master craftsman. Some of his work can be seen at some of the finest homes, hotels, and apartment complexes in the world. But I bet when he first started out, some of his work was trial and error. Not ready for prime time. And I can say for myself, when I was an intern learning to take blood, I had to stick many patients unsuccessfully with needles until I figured out how to do it right. Similarly, many of the common medical and surgical treatments that we use today had to go through an experimental testing phase. When I'm a patient, I request the most experienced doctors and well-tested, established medical and surgical treatments. You should as well. In summary, a successful, effective doctor-patient relationship can be achieved if each of you and your doctor are on the same page to make the best decisions for your medical care. Be sure your doctor has your correct name and accurate, up-to-date medical records. Be certain the doctor is following proper hand-washing techniques to avoid the spread of infectious disease. Seek out the most experienced doctors to get the best medical care available. The few minutes it takes you to ask these questions will help you live a healthy life for years to come. Thank you, Toastmasters today.
Great. Once again, another fantastic speech. Wow.